Continuing, emotional and coping problems like depression, anxiety, and fear can be seen. So we can deal this with the help of counseling, support group, family meetings, or make referrals to mental health professionals. So other problems are practical problems like financial and legal worries, insurance questions, and questions regarding the employment concern and concerns about completing advanced directives. Advanced directives means it's a legal document regarding the decision after the critical stage of a patient. So in some cases like critical situation, the patient will not be able to take further decision in his life. So in that cases, already we have to prepare a legal document regarding the care of a patient after he is being critically ill. So that also can be completed, advanced directives. Spiritual problems, the beliefs and values of the patient should be explored, and we have to make necessary arrangement according to that. Next is a symptom management. So we know that many symptoms will occur. So one by one symptoms should be managed. So pain, moderate to severe pain occurs in 80 to 90% of patients with advanced cancer. So we have to assess the pain properly by location, intensity, quality, pattern of the pain, as well as relief measures. First and foremost, we have to find out the causes of the pain. Then only we can treat the patient. So cancer-related chronic pain can be occur in case of bone infiltration, nerve compression, soft tissue infiltration. These all are readable points. Okay, all these things are readable points. Muscle spasm, lymphedema, raised ICP, as well as treatment-related pain can be seen in surgery, radiotherapy, as well as chemotherapy. Associated factors related to pain is constipation, pressure sores, bladder spasm, as well as stiff joints. So pain which is unrelated to cancer can be seen like low back pain, trauma, as well as emotional factors. So how can we control the pain? So we can control the pain with the help of pain ladder, which is created by WHO. Here there is 3-step ladder. In first step, it is telling that in mild pain we can go with non-opioid. According to WHO, non-opioid provided is paracetamol and plus or minus adjuvant. So in this adjuvant therapy means we are treating the patient with either NSAIDs, corticosteroids, antidepressants, anticonvulsants, as well as benzodiazepines. So these drugs will be using only based on the need of the patient. Okay, so even after we treat the patient by this, pain is not relieving. So pain is persisting as well as increasing means we'll go to the second step. In that we will use opioids, which is weak opioids. Here weak opioids which is given by the WHO is codeine as well as hydrocodone. So we can use weak opioids plus or minus non-opioids plus or minus adjuvant therapy. And still the pain is persisting or increasing, we'll go to the third step. In that strong opioids is being used. Strong opioids here mentioned are morphine, oxycodone, fentanyl, buprenorphine. IV can be given. So that is the pain ladder which is created by WHO. So next is regarding the morphine. Morphine is an opioid analgesic which can be given orally, rectally, parenteral, intraspinal, epidural, as well as subarachnoid. And long-acting morphine permits 8 to 12 hours. And dosing strength are like 15, 20, 30, 60, 100, 200 mg. When we are giving oral morphine, we can give 6 hourly. There are many side effects like addiction and all. Other than that, constipation, respiratory depression, sedation, as well as nausea can occur. So antagonist for this morphine is naloxone. You all know that. Other than opioids, other than morphine, we can use methadone, oxycodone, fentanyl. So all these things can be used, but main challenge is opioid addiction, dependence, as well as tolerance. Coming to the other symptoms, weakness, fatigue, anorexia, cachexia, constipation, nausea, vomiting, dyspnea, serostomia. Serostomia means dryness of the mouth. Cachexia means muscle wasting. Stomatitis means inflammation of the mucous membrane. Alopecia means loss of hair. So almost all sensory symptoms can be expected. So accordingly, we have to treat the patient. So in case weakness and fatigue, so when weakness and fatigue is occurring due to the cancer or cancer-related fatigue, the cancer-related treatment, it is termed as cancer-related fatigue. So what all may be the etiology? The cancer itself or the treatment for the cancer. Otherwise, nutritional deficiency, dehydration, psychological depression, sleep deprivation, inactivity, as well as metabolic abnormalities. So how can we treat? We have to treat the underlying causes and we can treat accordingly. So if anemia is there, we can provide erythropoietin. So in case of antidepressants, we have to use it. Adequate nutrition and hydration should be provided. We have to plan the rest as well, rest and activity, and schedule should be given to the patient. Adequate sleep and rest also should be planned. Stress management also should be done. Counseling, education, relaxation and massage also can be provided. Other than that, aromatherapy, food soak, reflexology also can be done to alleviate fatigue. So aromatherapy means here we are using natural plant extracts for the treatment. Reflexology means we are using massages, different types of massage which involves uh, like applying different type of amount of pressure over the feet, arm, as well as other parts of the body. So regular exercise program also can be planned. And next is regarding the anorexia and cachexia. So the cancer cachexia syndrome is characterized by anorexia, involuntary weight loss, wasting of muscle and fat tissues, poor performance status. So main cause is chronic inflammation itself. When there is chronic inflammation, there will be a presence of cytokines or inflammatory mediators in the body. As a result of increased amount of inflammatory mediators, there will be wasting of the muscle. So chronic inflammatory response that involves C-reactive protein, oral mucosal changes, which will lead to in decreased intake of the food, nausea, again the same reason, several cytokines, inflammatory mediators, tumor necrosis factors, interleukins, interferons also can contribute cachexia. How can we manage? So we can provide small frequent feeds. We can create a pleasurable environment. Food should be planned based on the likes of the patient. We have to encourage mouth care for preventing the oral ulcers. We can use different type of flavors and avoid spicy food. So there are some medications to improve the appetite, antacids, prokinetics, and cannabinoids. So these all drugs can be used to improve the appetite. Usually we are not using these drugs. So if nothing is works, commonly we'll go with parenteral nutrition.